You look at the community in Dacorum and you look at the community around this area, South Hertfordshire, there are so many complex needs. People are living longer, healthcare is better. And so more and more people have got more and more conditions that they need to deal with.
People's needs change, their health needs change, where they live change, how we access services, all those things change. And therefore services have to change to meet those needs.
Many communities in Hertfordshire, they depend on the community leaders or faith leaders or some of the faith organization when it comes to challenges within their health. So it is important that local authorities or local NHS partners working with those trusted members of the public to really meet the people's need.
People don't experience their issues in silos. If they've got a housing issue or they've got a finance issue, they're all interconnected to each other, which can all affect the person's overall health. And we can see that people's health can deteriorate as a result of that.
Care is holistic. It's physical care, it's emotional care, it's mental health support, spiritual support. We're complex beings. We have more than one issue, and probably the solution is more than one solution.
If we can bring together all the best services, the services that help people, the hospital or your GP or a local community group, those services are provided in a way that are joined up, that makes absolute sense for the next step, and you get the very best care that you can get for the best period from the best people.
I think Neighbourhood Health, to me, is really about making our community at the centre of health, not the other way round. By bringing everyone together, it will just make it so much easier.
So I think bringing services together enables people to have a one-stop shop. They don't have to duplicate what they have to say, don't have to repeat their stories, and having that interconnectivity is a big benefit, I think.
So essentially what we're doing is bringing together specialists that represent every aspect of life into one setting where a person can go in there with one set of symptoms which are connected to some other issues, but they can get all the support they need in that place.
Together we can bring clinical experience, local knowledge and community trust to reduce inequalities and bring better outcomes.